Stay with SmartTalk 1230 for your radio store, saving Bakersfield consumers thousands of dollars for decades. Now back to California Radio on SmartTalk 1230.
And we're glad you've joined us today for the Friday edition of Californian Radio. By the way, you can find us on the web at www.smarttalk1230am.com. And your host today, Richard Bean.
And if you have any questions on plastic surgery, we're going to get briefed by Dr. Brett Lehocky of Butology. He's in with Dr. Shaw. Mm-hmm. And I've been wanting to talk about this because, and welcome, Brett.
Thank you.
And look at me. I've got a face for black. I mean, I'm like, you're perfect. This is the only face a mother could love. I mean, the work that could be done on me alone would amaze people.
You could retire, right?
Yeah.
No,
but
no.
I'm really interested in this, and I've been interested in this because I'll tell you, it seems to me, Brett, like in the last decade or so, this thing has just exploded. Your business, and women, men. I had read something, even though you corrected me, I'd read something in a trade mag about men being one of the fastest growing segments. You say that's not particularly true here in Bakersfield, but
well, to use the word fastest growing, that might be true because men didn't access plastic surgery, weren't looking for it compared to the numbers of women. And you're right, more and more are. So perhaps you are correct to say that it's fastest growing. But the numbers of men, at least in Bakersfield in our practice, for plastic surgery like that I do, the numbers are much smaller. I would say that it's 95% women that I do surgery on and 5% men.
Yeah. Now, tell us about the generally what are the top kinds of plastic surgery nationally, and how that would compare here. Let's start with women.
Yeah, the statistics and how these statistics come about is surgeons such as myself we send our numbers into the national societies. They ask for it every year, and we give them the numbers, and then it gets tabulated. And so the numbers for breast augmentation for women are still number one and have been number one for years. Liposuction is very close, but there's still 300,000, 250,000 procedures of breast augmentations that are done every year. And
now, to you guys in the trade, you refer to breast augmentations as bolt-ons.
I have never used that term, I must say.
I was just curious.
No, we actually call them breast augmentations.
Okay, all right.
Sometimes we have to use more lay terms on things. An example is tummy tuck. The medical term is abdominoplasty, but that makes it sound so foreboding to be getting an abdominoplasty.
Now, that would come under liposuction, though, right?
Abdominoplasty, you can see it on our little chart there. It's down a ways, and that's a very common procedure for women, especially because women have babies, and babies cause changes to women's bodies, and of course one of the areas they do is right in the center. And unfortunately for women, I mean, that's one thing us men don't have to really worry about is having babies, because babies do damage the skin oftentimes. Stretch marks are one way that everybody can see, but the actual skin itself gets damaged, and one loses the elastic component of the skin. And in doing so, no matter how much a girl works out or how much she diets and how good she is to herself, sometimes the skin just won't help her. And that's where I have to come in.
Okay.
And that kind of leads us into one of the topics that we might be discussing later on is for men is when your wife wants to have plastic surgery or to have some kind of cosmetic surgery, what should you be thinking?
And what should we be thinking?
We have to think about it differently than women do. And one of the things that I've learned being a guy and growing up worrying more about cars than my body is that I like to use that as an analogy. When I have a husband and a wife, or a wife that's saying, my husband he's not on board with me.
Do the husbands normally come in for these consultations, or is it just the wife?
It's a little of both, 50-50. And I love it when the husband or spouse or significant other comes in, because it shows that the woman has support, that she's not just kind of doing this on their own. In fact, a red flag that that I have is when a woman will say, I don't want you to tell my husband or my significant other that I'm doing this. And that's really not the way you should approach it. It should be open. You should, because you're not going to be able to hide it after a person's had surgery, unless your husband's out of the country. And believe me, I get that. Husband's out of the country. Around here, oil people are out of the country. And the wife wants to get something done while he's out of the country. But the point is, it's a team effort. It's not just one doing it by yourself. So to get back to your question as far as
we're gonna have to take a break
here.
We're gonna get back. I want to talk
because it's an interesting topic.
Yeah, I want to talk about how people choose a surgeon, a little bit more about your background, some surgeries for men, and also debunk a myth that plastic surgery or cosmetic enhancements are only for the rich, because some of your statistics show that it's really everybody's doing it.
That's exactly right.
Okay, we're going to get right back. 631-1230. Give us a call after the break. This is Californian Smart Talk Radio. Smart Talk Radio.